Okay, we're back again, Chapter 2, Human Reproductive Anatomy and Physiology. So let's continue on. You can review the objectives on your... Okay, so puberty. The reason why this is super important to talk about childbirth, it requires an understanding of structures, functions of the body that will all apply now, what you have learned in other classes to get to this point. We can apply them to what's happening for reproduction and for childbirth. So we're going to talk about anatomy, physiology, sexuality, embryology of the growing fetus, and psychosocial issues that goes along with all this. So before all this can even happen, we need, well, boys and girls have to go through a period called puberty. It involves changes in the whole body and psyche. As we know, before puberty, boys and girls appear very much alike, except for their genitalia. And puberty involves changes for the whole body and psyche as well, and the way society looks at them and treats them. They're starting to get into adulthood, and most people in puberty want to be recognized as that. So what happens in puberty is reproductive system matures, becomes capable of reproducing, and secondary sex characteristics appear. It ends when mature sperm are formed in males. Menstrual cycle becomes regular in females. It's very celebrated in many cultures as a rite of passage into adulthood. Other cultures lack this ritual, which can be very confusing if you go to school with one kid that does it and the other that doesn't. It's like, am I becoming an adult or not? Some kids get a little confused, but parents can set them straight, right? Okay. So, male reproductive system. This is in your book. I just think it would be a good thing to review while you're looking at it, and remember for your tests and for your NCLEX. So let's start with the male. Hormonal changes begin between age 10 and 16 years. Yes, age 10. I had a 12-year-old girl had twins one time down when I worked in Southern California, and the boyfriend was 13, brought a skateboard under his arm. Anyways, things can happen at a very young age. So we have to start our kids pretty young learning about this information. Okay, outward changes in the male. Penis and testes increase in size. They usually grow taller and more muscular. Secondary sex characteristics such as pubic and facial hair. They get a deeper voice. Testosterone levels with voices cracking. Usually it's just testosterone levels aren't evened out yet. And then they become consistent. Nocturnal emissions, like otherwise known as wet dreams, may occur. It's a very normal process, and they need to know that it's nothing to be embarrassed about and be able to talk about it. The wet dreams don't contain sperm, so there's no danger of anything like that. Okay. Female. First outward changes in puberty, which you need to know this, you guys, for future testing, is the development of breasts. Reproductive organs mature to prepare for sexual activity and having babies. Unfortunately, girls' hips broaden. Some girls may like that. Some girls, it's like, okay, broaden up already, but that's the way it works for us women. Pubic hair and axillary hair appear, and let's move on to this first question. What is the first outward change of puberty in males? So, development of pubic hair. Right. External genitalia, page 23. Okay, so the penis has two functions. It expels urine from the bladder and deposits sperm into the female's vagina. Contains erectile tissue. Blood is trapped within the spongy erectile tissue to enable erection. You've heard men with, it's called priapism, when they have a erection that won't go away. The blood gets trapped in there, and that's what's causing the problem, and they have to get that blood out. Scrotum is the sac that contains the testes suspended from the perineum. It helps keep the testes cooler than the rest of the body, which is super important with fertility issues. Decreased sperm production can be caused by testes being too warm. That's why they say don't wear tighty-whities. That's why they say, you know, if they're having fertility issues, don't sit in hot tubs, things like that. This is necessary for spermatogenesis, for, you know, making of the sperm, right? All right. Internal genitalia, the testes, manufacture male germ cells and make spermatozoa or sperm, secrete male hormones such as androgens and testosterone. Testosterone is a very important hormone for males. It controls a lot of what they do and feel. It's not related to sexual reproduction as far as this part increases muscle mass and strength, how men can build up their muscles and promote growth of long bones. They can get bigger and taller usually than women. Increases basal metabolic rate, which for us women, it sucks. They can lose weight so much faster than us usually. Enhances production of red blood cells, produces enlargement of the vocal cords, why their voice gets deep usually, and affects the distribution of body hair. You know, they can grow beards and hair in places women don't usually grow. All right, there's ducts, okay? So the epididymis is an important one. There's one from each testicle. It stores and carries sperm to the penis. The thing to remember is it can store sperm for 2 to 10 days. Then the spermature move to the vas deferens. The urethra transports both urine from the bladder and semen from the prostate to be expelled, but not at the same time. There's a function that happens that closes off each side when the other is happening. Okay, accessory glands. We have seminal vesicles, prostate gland, there's Cowper glands. So the job is to produce secretions of these glands, all right, to nourish the sperm, protect sperm from acidic environment within the woman's vagina. As we know, you want a more alkalytic environment, and we want that sperm to be protected because the acids can cause problems with fertility. And it also enhances motility of sperm. Semen is actually the seminal plaza and sperm mixed together. Okay, onward. External genitalia of the woman. It's collectively, the whole bottom is called the vulva, and we'll look at the picture. It includes, as you can see, the mons pubis, labia majora, labia minora, fourchette, clitoris, vaginal vestibule, and the perineum. Okay, so the mons pubis is a pad of fat tissue covered by coarse skin and pubic hair. It protects the symphysis pubis. So the symphysis pubis is that where your bones come together down at the top of above your labia. And that is a very important part of childbirth. That symphysis pubis has a cartilage in between the bone that spreads with the growing fetus. So it's made to do that, but it needs protection. Then we have the labia majora. It has 2 folds of fatty tissue on each side of the vaginal vestibule, and it has a lot of glands in that area. The labia minora, the smaller one, 2 thin, soft folds of tissue, secretions from sebaceous glands. So it's bactericidal. It kills the bacteria, so we don't get foreign things up in our cervix and our uterus. Lubricates and protects the skin of the vulva. So the fourchette is important for us in OB. It's the fold of tissue just below the vagina. It's also known as the obstetrical perineum, and we'll talk more about that. Then there's the clitoris, which is the erectile body, most sensitive part of female genitalia, and produces smegma. So smegma is produced in women and men's penises. It's a cheese-like secretion of sebaceous glands. So you have this picture in your book, and it's of the female reproductive system. So I just want you to look at the top. It says mons pubis. That's what I was talking about, that covers that symphysis pubis. Okay. Then your clitoris. And look at where the urethra is. So you open up the labia minora and majora, and you see all this when you go to put a catheter in or do a vaginal exam or anything like that. And it's very interesting to me how many women don't realize that they have 3 different holes down there. Just the other day, we had a woman that was just shocked that you had 3 holes there: the urethra, the vagina, and the anus. A lot of people do not realize urethra is its own separate little entity there. Just a little tidbit there. Anyway, then you can see where the vagina is. You can see the labia majora, it's larger, labia minora, smaller and inside. Then the opening for the vestibular glands, you can see those 2 little holes there that secretes the, has secretions. Then there's the obstetric perineum that goes from the vagina, the bottom of the vagina, to the anus. Now that's where, if a woman tears during childbirth, a laceration, that's where that would happen usually, or an episiotomy, that's where they cut straight down. They don't cut too far because you don't want it to get all the way through the anus. Now, if it tears all the way through the anus, that's considered a 4th degree laceration. And that's pretty wicked, and it takes a lot of time for recovery, and some women never recover from it. But it's just a wicked tear that you can imagine could be very difficult to heal from. Okay, so let's review the external genitalia of the woman. So here's your vaginal vestibule. So urethral meatus that we looked at is the exit for the urine. Skene's ducts lubricates the urethra and vaginal orifice. Vaginal introitus. So at the introitus is where you look to see if there's anything going on in there, if you think there's a problem with an infection or something. Divides the external and internal genitalia. The hymen. So in this picture to the right is a picture of an intact hymen. And in the middle there, towards the top, you can see what looks like just a little, possibly a hole. That's where menstruation comes through until the hymen is broken. Now, some women can deliver a baby, and I remember the first time I ever saw it. The midwife was delivering a baby and the head was coming down, and I saw this piece of tissue over the top of the baby's head, and I said, "What is that?" And she goes, "That's part of her hymen." And I thought, oh, wow, so I guess it just must go to the side instead of completely breaking off for some women. Anyways, usually, in older days, that was always a sign of virginity if they had their hymen. But the thing is there are other things that can make a hymen not be intact, horseback riding, having trauma, things like that, car accidents. There's things that can snap that. So anyways, ducts of Bartholin's glands, that lubricates the introitus during sexual arousal, and that's not normally a visible thing. Perineum. So that's that area we were looking at. It's a strong muscular area between the vaginal opening and the anus. Allows stretching for birth. You should see when a baby's head is crowning how much it can stretch out. It's just, you'd be surprised. And also, like I said, it's a site of episiotomies and laceration. So internal genitalia for the woman. So the vagina is a tubular structure. It's muscular and membranous tissue. Connects external genitalia to the uterus. So it's that long tube that connects from the outside to the inside. Rugae. So it's that transverse ridges that are used during sexual intercourse and delivery of the fetus. Believe it or not, those ridges help bring that fetal head down and out during labor. Self-cleansing. During reproductive years, we need to make sure that it's being kept clean down there. And as you've learned in past classes, pH is super important for a woman down there. That's why they say, of course, don't douche very often, don't use those sprays, things like that, because it changes your pH. And pH has to do with what bacteria gets killed, things like that. So it's very important for our pH to stay stable and our body does have that self-cleaning way of working. So functions: provides passageway for sperm to enter the uterus, and that sperm can swim far and fast up into the uterus, fallopian tubes. Allows drainage of menstrual fluids and other secretions. Provides a passageway for delivery of the fetus. So here's a side view of the female reproductive organs. You can see the fallopian tube up there, super important for fertility. Then you can see the ovary there below it. It's an opening in that fallopian tube. Then see in the middle, that is the uterus. And see how small it is? And you can see the cervix. See where shows the cervix? Well, cervix is usually very long. It's usually 3.5 to 4 centimeters long in a non-pregnant woman or a pregnant woman early on. And as you can see, the uterus in the center, this is considered non-gravid. It does not have a fetus in there or an embryo. Then the bladder, you can see how close that is to the sorry, this is the third time I've had to do this because my computer freaked out. But anyways, into the uterus. So bladders can affect uteruses during labor and delivery. You always have to make sure that the bladder is empty. As you can see, if you have a full bladder, it can push up against that uterus and cause, and as you can see, right next to the vagina, and it literally can block the fetal head from coming down the vagina. So that's always something to keep in mind in the OB world. Then you can see where the rectum is, and just it's kind of interesting to see the placement of everything and how it affects each other. Okay, so again, the uterus is a hollow muscular organ. Fertilized ovum implants and develops into an embryo in the uterus. You know, the zygote is what travels, and then the embryo implants. It's shaped like an upside down pear. Lies between the urinary bladder and rectum above the vagina, supported by several ligaments, but the one that I want to talk about is the Brown ligament. That's the one I hear the most about in the OB world. They lay down below a woman's abdomen on the sides near where their hip bones are. And they literally can grow several inches with pregnancy. And they can get very tender, and sometimes women have spasms in them. So you hear women come in and they're like, I have this terrible pain. Usually it's women who've had several babies and their ligaments and muscles are just getting tired and don't work as well, as efficiently. And sometimes it's just, you know, trying to hold up that pregnancy, and they hurt for some women, and some women don't even know they're there. So the uterus has an autonomic nerve supply, so meaning it's not under voluntary or conscious control. Various motor and nerve roots supply sensation to the uterus, so that's an important factor in pain management during labor. So we will learn about gate theory with pain management during labor, about intraspinal narcotics, spinals, things like that, and how it affects those nerve roots. Uterus. Continued. So the fundus is the top part of the uterus, and after a woman has a baby, that's the most important thing to check, to where the uterus location is, and in another class we'll get to that, but to see, make sure they're not filling up with blood inside their uterus. It should be below the uterus, umbilical. Okay, then they have 3 distinct layers. Perimetrium, that's what envelops the whole uterus. Myometrium, so middle, myo, functions during pregnancy and birth. Endometrium, so I always say endo, inside, governed by cyclical hormonal changes, and it is the layer that is responsible for implantation. Okay, so go ahead and look down at the pictures. The fundus on the picture in the middle here, you can see the fundus on the top. That's the top of the uterus, the body, that's the uterus. Fallopian tube, you can see go up in the infundibulum. The fimbriae are those finger-like projections that help move the ovum and then out to the ovary and then back through the fallopian tube. And then you can see the lining, endometrium, myometrium, perimetrium, the broad ligaments, uterus, rugae, cervix. You can see the rugae there down along the vagina, and then the Bartholin glands that help with lubricant and bactericidal. But to the right, I just thought it was such an interesting picture of what it truly looks like. So you can see the ovary on the right. You can see the fallopian tube traveling there. You can see this woman has some cysts there. Women can get pain on their ovarian sites, and it can be from cysts. The little cysts to the right can rupture and usually do okay, but big cysts sometimes have to be removed. Anyway, then you can see the uterine cavity, the uterine corpus. And the interesting part of this is the cervix. So that is, you can see how long that is. So from the cervix into the uterus, down at the very bottom where that ruler is, you can see that there's a little hole there, a little dent, and that is where you would check a patient to see how far dilated they are. So you would go up through the vagina, up to the bottom of this picture where that little hole is, cervix, and you would check to see if they're dilated. So I just thought it was a kind of cool picture to show you what it really looks like. Okay. So it contains the cervix, like we just saw, the neck or lower part of the uterus, consists of the cervical canal with an internal opening near uterine corpus, the internal os opening, and there's an external os. So sometimes you will hear, if you ever came into the OB unit and we check them and we go, oh, external os is 2, internal os closed. Well, the cervix, again, in a non-pregnant woman or a pregnant woman that has not had labor yet, their cervix is 3.5 to 4 centimeters long. So if you think about going in to check, sometimes the bottom of the cervix, you go, oh, I can get a finger through that. And then it's like this big tunnel going all the way through to the internal os, which it could be closed, could be one, could be more. But that's the opening that's right next to the fetal head, okay? So, and that is also where the mucus plug sits, is in that long cervix. And the mucus plug acts as exactly what it's saying, a plug. So the bacteria can't get up in there. You know, you hear men freak out having sexual intercourse with their wife or significant other, that they're going to hurt the baby or they're going to, you know, give the baby something. Well, it not only is the cervix long and thick, but it has that mucus plug that keeps bacteria from going up inside and anything else. Bacteriostatic agent, it's an alkaline environment, lubricates the vagina, and so that cervix is a pretty important part of the whole pregnancy process. Fallopian tubes, another very important part of the process. 4 sections: interstitial, isthmus, ampulla, infundibulum. Again, it's in the infundibulum is those finger-like projections that capture the ovum, so the egg, as it's released from the ovary for fertilization, okay? 4 functions: passageway for sperm to meet the ovum, site of fertilization. So you need to know, usually the outer 1/3 of the tube is the site for fertilization. It's a safe, nourishing environment for the ovum or zygote. Fertilized ovum is the zygote. Means of transporting ovum or zygote to the corpus of the uterus. So ovum is the egg, zygote is the fertilized ovum, okay? And here's your ovaries. They're almond-shaped. I thought this picture was awesome to really show what they look like. Size of a walnut. You can see it's those yellowish looking things there, held in place by the ovarian and uterine ligaments, and you can literally see some of those ligaments holding on. So the uterus in the middle and then the ligaments holding on to those ovaries. So there's two functions: production of hormones, mainly estrogen and progesterone. Progesterone, they're finding, is super important for holding on to a pregnancy, for implantation, holding on to the implantation, and preserving the pregnancy. So that's one of the things that they look at with infertility patients is progesterone levels. And a lot of women get on progesterone shots. Ovaries also stimulate maturation of an ovum during each reproductive cycle. So we need a mature ovum to be fertilized if we want to have a baby. So oogenesis. So just to put it in perspective here. So when I was born with all the eggs I was ever going to have, okay? All the ova. So it usually starts at around 2 million. When I became an adult, I probably had it in the thousands. Then by menopause or climacteric phase, which, by the way, climacteric is usually right before menopause and then menopause. But either way, the ova no longer mature in response to hormonal stimulation, and that's why they don't get pregnant. So functions of the bony pelvis. There's two parts to it. So if you think about looking at the pelvis, there's a picture in your book. You draw an imaginary line in the middle, and there's the top and the bottom. So there's two innominate, I don't even know how to say that, bones, the sacrum and the coccyx. They support and distribute body weight, support and protect pelvic organs, and form the birth passageway. So there's 4 types of pelvises. So down on the left is the gynecoid. That is what we want for a vaginal birth. Remember that. Most favorable for a vaginal delivery. Okay. So see the blue part in the middle? Picture a fetal head there. That is the shape of a fetal head. You can see how it could fit. That pointy thing coming down is the mom's tailbone, the sacrum. So as you can see how that can make a difference if it's not movable. Then next to that is the android. That's a male pelvis. And it's not very conducive to having a vaginal birth through there. Anthropoid, you can see the next one. Look how long and oval it is. And look to the left at the gynecoid. Look at the fetal head. Do you think fetal heads, that looks more like what would be an alien on the anthropoid coming through? Platypoid, just like it says, like a platypus, flat. So it's wide and flat. So a fetal head, that is the most unfavorable pelvis for a vaginal delivery. Now, do we know what kind we have? Not usually. And most of us will never know what kind of pelvis we have. Some of us can have a little combination of each. It just depends on how we were made and put together. So true and false pelvises, again, they're separated by an imaginary line. False pelvis, its work is to support the enlarging uterus, guides fetus into the true pelvis. True pelvis dictates the bony limits of the birth canal. So again, it's the ones we just talked about. Pelvic inlet. So in your book, page 28, you can look at those and see why they matter. It's just measurements that determine if fetuses can pass through. There's different diameters, things like that. You can look at it on page 28 on the bottom, the fetal head diameters and the pelvis diameters, and see why that's important. Now, do people measure these, and can we tell in advance, oh yeah, nope, yours isn't good, you're not gonna have a vaginal birth. Yep, yours is great, you'll have a vaginal birth. No. They can do their best on a manual exam. The doctors, the nurses don't have anything to do with this part. But this is where it matters, because fetal head has to come through at a certain, direction, right? Comes down and through. But fetus has their role in it by molding their tissues and their bones in their head to accommodate that. So that's why sometimes babies can deliver depending on their size and mom's size, things like that. Okay, so you can review that. This is where the coccyx comes into play, the tailbone. It can move or break during passage of the fetal head. You literally can hear it snap sometimes, and that is just horrible. Now, the interesting part to that is oftentimes the woman doesn't feel it because there's so much pressure of the fetal head on that's more what she's feeling than the coccyx, okay? So what happens is, though, if you have an immobile coccyx, say someone had a broken tailbone when they were younger and it healed and it's calcified, so it can't move, it can make the vaginal birth difficult. It needs to be able to swing back and forth, that tailbone. Okay, so breasts. It continues to amaze me how much there is to breasts. Just there's so many ducts and tissues and important things for breastfeeding a newborn. So let's continue on and see. One thing I do want you to look at on the right is the alveoli, which hold the milk. Okay, the areola is important and the nipple with latching and stimulating those milk ducts for breastfeeding. On the left side, I want you to look at the alveolus and the lactiferous ducts, how they all are connected to come down through the nipple and feed that newborn. So breasts are an accessory organ of reproduction. They produce milk after birth. Oftentimes women start producing colostrum during pregnancy, and they can leak it also. But it provides nourishment for the infant, provides maternal antibodies to infants. We at my birth center, we oftentimes will really encourage the patient to at least, if they are not planning on breastfeeding, to at least do it for the first couple of days. Get that colostrum that is just full of those awesome antibodies. Those antibodies really help the baby's gut, things like that. And there's a lot to it. It's interesting if you talk to a lactation consultant, that they are people who specialize in breastfeeding. They literally go to school for like 9 months to learn about breastfeeding. There's so much to it. And that's one of the things they have found, like with preemie babies and stuff, that they will literally buy, if the mom can't get the colostrum, they will buy it, or breast milk from banks, because there's something about closing the baby's guts so they don't get necrotizing enterocolitis, which is a horrible thing that preemies and sick babies can get. Okay, so the size of a woman's breast is determined by the amount of fatty tissue. It does not influence her ability to secrete milk. So just as an example, my daughter has a friend who had a baby. She, a couple days after birth, came over to my house just stressed out because the baby was screaming. She couldn't settle the baby down. She was breastfeeding, and I said, so I asked her a bunch of questions. I did my assessment, right? I assessed her breast to see if it was filling, or you can try to hand express to see if you get anything out. And then my next question to her was, did you have any changes in your breasts during pregnancy? And she said no. And I said, nothing? She goes, nothing. So women usually, that's one of the ways they can even tell they're pregnant sometimes, is their breasts are super tender. They get larger. They get a lot of veins. Not all of them, but a lot of people do. Stretch marks, things like that. Well, if you get a woman who had 0 breast changes in pregnancy, the odds are against her for being able to breastfeed, but that's very rare. And in this instance, my daughter's friend, she had no milk to give this baby. So ended up being a bottle-fed baby, but she did try, and we try everything first, of course. Anyways, then in the breast you have your Montgomery's glands. They're small sebaceous glands. They secrete a substance to lubricate and protect the breast during lactation, milk production. So again, the alveoli are the lobules that secrete the milk. The lactiferous ducts carry the milk, and the lactiferous sinuses store the milk. So, okay, here we are now, reproductive cycle and menstruation. So let's go to page 29. Oh, and just a little side note on the alveoli lobules. They're glands that secrete the milk, remember. They empty into approximately 20 separate lactiferous milk-carrying ducts. So that's interesting with how many ducts have milk in them for the baby to be able to get when the baby nurses or breastfeeds, right? Okay. So back to reproductive cycle. We consist of regular changes in secretions. The anterior pituitary gland sends out messages and hormones and deals with ovaries, endometrial lining of the uterus. So all this plays a part in menstruation and reproduction. So the follicle stimulating hormone and LH stimulate the maturity of the ovarian follicle. So maturing ovum and corpus luteum produce increased amount of estrogen and progesterone. And again, progesterone is super important for maintaining pregnancy, and estrogen is a huge part of a woman's hormonal makeup. Surges of LH stimulate spinal maturation, and then it releases that ovum. Now, whether it gets released to get fertilized or goes out with menstruation is dependent on what they want to do, right? Okay, ovulation. Mature ovum is released from the follicle about 14 days before the onset of the menstrual period. The corpus luteum turns yellow, secretes increased quantities of progesterone, again, to help the pregnancy. If you're going to, all this is for reproduction. Whether we use it for that or not is our choice. Corpus luteum degenerates if the ova is not fertilized. So your hormones go back down and the endometrium breaks down, which results in the menstruation. Then cycle begins anew. So development of breasts occur first. Usually it starts at around 11 to 15 years of age. They actually say that a lot of women start their period when their mother did. So I was 13 and my mother was 13, which is interesting. Not always, it's just kind of a little rule of thumb. Growth spurts in women, girls, and earlier than in the male, and our hips broaden and pubic and axillary hair appear. This is just a good little thing to use to look at the reproductive cycle and menstruation. It's just look it over and see if it makes sense to you. Okay, human sexual response. There's 4 phases. There's excitement, there's plateau, there's orgasmic, and there's resolution. Physiology of the male sex act. So just keep in mind the psyche plays a very strong role for women and men with the sex act. And that can affect fertility also. Okay, how about if a man, come home now, I'm ovulating, I need you, come on, put out. And do you think that some men's psyche is like, I can't on demand, things like that, and same with a woman. Some women have to be wooed. And so my whole point is the psyche plays a huge part in fertility and reproduction and the sexual act. So for a man, the massaging action of intercourse usually stimulates the nerves. Parasympathetic, that is, you're pokey, you're slow, so it's relaxation of penile arteries leads to increased blood flow to the shaft, which is the erection. Again, for an erection, fills up with blood, and then urethral glands secrete mucus to aid in lubrication for sperm motility. Rhythmic contraction of penile erectile tissues, urethra, and skeletal muscles lead to expulsion of semen, which is known as ejaculation. So, physiology of the male sex act. So after the man has an orgasm, that's considered resolution. Same with the woman, actually. Then erection ceases, the sinus is empty, arteries contract, penis becomes flaccid. Usually takes time for a man to be able to recoup and do that again. Then sperm can reach the fallopian tubes within 5 minutes. Pretty darn quick. Can remain viable in the female for up to 4 to 5 days. So that's kind of important to know, okay? So again, what we talked about with a man, their, penis gives urine and sperm, right? Well, what happens is the sphincter at the base of the bladder closes during ejaculation so that sperm does not enter the bladder and urine cannot be expelled. That's the process that happens. Why you don't get both at the same time, okay? Physiology of the female sex act. Again, psyche can initiate or inhibit sexual response. Stimulation of the breast, vulva, vagina, and perineum increase sexual sensations. Parasympathetic nerve signal erectile tissue around vaginal introitus. That's the opening, the very beginning of the vagina. Dilation and filling of arteries leads to tightening of vagina around the penis. And it stimulates the Bartholin's glands to secrete mucus, which aids in vaginal lubrication. All this stuff is important stuff, right? So, posterior pituitary gland secretes oxytocin. Oxytocin is very important. You hear this term a lot in a woman's world. So, oxytocin is what's responsible, they call it the happy hormone, things like that. Like during sex, it's released and causes a lot of the euphoric feeling. Oxytocin is also what stimulates contractions during labor. It's also what is used for breastfeeding. Now, the reason why it's a concern for preterm people or people that have a history of high risk for miscarriage or preterm labor, why they say don't have sexual intercourse is because of this. It stimulates contraction of uterus, release of oxytocin, which can cause contractions, and dilatation of the cervix. So we certainly don't want that to happen on these people that are already at high risk. So they're usually told to abstain. Orgasm is believed to aid in transport of sperm into the fallopian tubes. Egg lives 24 hours after ovulation. Sperm must be available during that time for fertilization to occur. So I also encourage you guys, as I've already said, to review key points. And a couple of the things I'd like to say is just remember, a sexually active girl can become pregnant before her first menstrual period because ovulation occurs before menstruation. So that makes sense. Testosterone is the principal male hormone. Estrogen and progesterone are the female. And the myometrium, the middle muscular uterine layer, is functional in pregnancy and labor. And remember that gynecoid pelvis is most favorable for a vaginal birth. Okay. So any questions? Again, I'll try to have a question answer at the end of class time, hopefully from 1 to 2, just depends on how long lecture goes. And we'll move on to chapter 3.